Just a couple of housekeeping announcements. You're probably familiar with the format for these. We're going to have a panel very shortly, and I'll introduce each of our very eminent and very exciting panelists, really, as I got to know them over the last few days, reading about them mostly. We'll do about a half hour of that, and then we'll have a few questions and answers from you, and then we'll break into small table groups, get a distillate of that from a sampling of you in the audience, and then some parting thoughts from our guests. I think I'm going to sit down, and we'll make this casual from here on out. I work for the PBS NewsHour, which has its roots and most of its audience around the dinner hour, which makes reporting on sanitation a particular challenge. And I wear it as a badge of honor that I've been able to do reporting in this space. One of the most engaging reports that I've ever done was about David Kuria, who some of you might know, who started EcoTact and Eco-Toilets in Nairobi. David is the founder of EcoTact, and he has been very, very successful. He's a for-profit entrepreneur in building toilet malls in Nairobi, and he's looking to do more of these in the slums based on an interesting business model that takes aspirational marketing. One of the most memorable quotes from David, which I could not use on television, but can be our theme for this afternoon, is when he said, "The shit business is great." He really meant that because it has been very successful thus far. It's all about inspiration and aspirational marketing, he says. His first toilet mall was in the poshest part of Nairobi, where the well-to-do use it, and he figures the best aspirational ploy is to sell eco-toilets in the slums on the notion that it's good enough for the well-to-do, so why not make it good enough for me? That's the big rub, how to sell something that people are not used to paying for, which is an indoor public toilet. Our first panelist, who I will invite up, is Miriam Atuya. Has witnessed this firsthand. She's a student at Trinity University and has worked for Samergy in much the same sanitation enterprise space, coordinating with microfinance agencies and others to bring sanitation to the poorer sections of Nairobi's capital. Miriam will share with us the challenge she faced in marketing the idea of indoor toilets to people at the margins who must make this tough decision on whether they can afford an indoor public toilet. Sebastian Tillmans has upped the ante a little bit and wants not just to provide the dignity of an indoor public toilet, but the status of an in-home private toilet. He's a PhD candidate at Stanford, and his enterprise, Re.Source, is working on a project I'm anxious to hear about in Haiti. Given the state of most toilets that people use in the developing world, no one in their right mind would want something like that in their homes. But Sebastian is a civil engineer, and his toilets are cheap and combine, this is a quote, a 20-liter bucket, liquid container, Western-style toilet seat sealed in a portable urine-diverting toilet. Wow. Sebastian, welcome. Good engineering. Gary White is a giant in this field. With actor Matt Damon, he co-founded Water.org and its predecessor more than 2 decades ago. He's credited with numerous innovations in the way water and sanitation are delivered, and Water.org says it is on track to serve 1 million people by the end of 2012. I guess we're past that, Gary. We've got to see if you made that. Including, and I'm really anxious to hear about this, his water credit initiative to finance water and particularly sanitation for people. He's the recipient of a gazillion awards and who knows how many halls of fame in the toilet and sanitation space. He has 3 engineering degrees, speaking of engineering, but he's going to tell us that it takes a lot more than engineering to succeed in this field. Gary, thanks for being here today. finally, Ned Breslin, who, like Gary White, is the recipient of the prestigious Skoll Award.
No, never mind, they got one.
Way at the end.
I was going to sit on wasn't one there.
Not worth it. These two guys are both recipients of the very prestigious Skoll Award for Social Entrepreneurship. And Ned heads the group Water for People. He's a veteran of many water and sanitation ventures. And at some point, I hope we can talk about how we separate water and sanitation and what special challenges it takes to deal with sanitation, which I can tell you from the media business has a lot less sex appeal than water. Ned believes that there are a lot of good ideas and money that are chasing unsustainable ideas, unsustainable projects. In his approach, he often uses absolute terms like everyone and forever. Well, Ned, the time is now, and we're about 2.5 billion people short of sanitation for everyone. And I'd like to begin with a question to you. What would you say are the top 3, 4 reasons why a well-meaning, even maybe well-engineered project goes awry?
Well, thanks. It's a real honor to be here. So I started working in northern Kenya in 1987. I fear there might be people in this room that weren't even born yet. So, and I worked in Africa for about 20 years. And what I saw over that period of time was governments, bilateral donors, foundations, NGOs, church groups, student groups, all these people kind of flying in, putting in projects, celebrating that a well was dug, pictures taken, donor reports sent in, and none of them worked. So when we talk about 780 million people around the world who don't have water, I think very few people in the sector actually believe that. It's closer to 3 billion if you ask simple questions of whether water is actually flowing. And in sanitation, a recent report by UNC just estimated that 4 billion people actually don't have access to improved sanitation. The reasons are fairly simple. One is that we've always focused on short-term results. We've focused on, did you build a toilet? Did you drill a borehole? Did you put in a hand pump? And that's the easy part. For us at Water for People, that's day one of the project, once water flows. The second is that it's a finance question. So many around the world, you have almost no example of communities who have refinanced their water system as it ages and needs to be replaced, let alone the massive failure of finances to keep systems going, whether they're toilets or whether they're water systems, all require ongoing work, all require finances and all of that. Third is it's a management problem. And, you know, Denver Water, I'm from Denver. Denver Water doesn't just pump water out. It's managed. Resources are kind of debated. We're going into a drought this year, so nobody can water their lawn. Tariffs are rising. And so all this stuff has to happen. And so what people have done is they've tried to find little ways to get water and sanitation to people. They've tried to find financial mechanisms, or they've done it as a grant, or they try to get people involved. But they don't have the stamina or the vision, I think, to stick with this over time. And so Africa, Asia, and Latin America are wastelands of broken technologies, broken dreams, broken hopes. And we tend to focus it on quick fixes, and we tend to do a lot of work on technology, which is not a technological problem. And we do short-term upfront finance as opposed to long-term finance needed to keep things going.
Mm-hmm. And Gary, you've been around for a long time and seen a lot of efforts, not only in efforts to maintain creaking old systems and overburdened systems, but also in virgin areas that have hitherto not had any sanitation. What are the signals, perhaps early, or red flags that something's going wrong in newer enterprises?
Well, thanks, Fred, and again, great to be here with this crowd. CGI is the second time I've done this, and I'm always just blown away by how creative and thoughtful the attendees are, and looking forward to hearing more ideas from you after the panel, or during the second half of the panel. I think one of the things that I see as a red flag And I think, Ned's already hit a lot of them, and they're spot on. I think when I see if something is technology-led, right? So if that is kind of the tip of the spear in terms of a solution, then I think that the probability of it succeeding is pretty low. And I think that, we talked about my engineering degrees. I have 3 engineering degrees, so I can take on technology a little bit here and show that it's not a panacea. So I think that's one thing. I think the other thing is that historically, a lot of those upfront investments that Ned was talking about come in a supply-driven way. So projects are built for people instead of with people. The fact that, I remember being in a village in Guatemala several years ago, early in my career actually, and every house in that rural village had 3 toilets, 3 latrines. Why did each one have 3 latrines? It's because 3 different NGOs and aid agencies came along and said, we're here to help you with sanitation. Do you want a latrine? And nobody in their right mind says no, right? They used one to store their tools in. They used one to store grain in, usually. And if you're lucky, they're using one to defecate in.
I was just going to ask, are any of them actually being used anymore, and what the life expectancy is of
these? So I think that what we're trying to do is to show a demand responsiveness. So how do we see people in the developing world as potential customers as opposed to recipients of aid? And one of the things that we do with that is by helping them get access to microfinance so that they can kind of exert their own voice as a customer into the type of sanitation solution that they want. And once they have that power as a customer, they can get the particular type of toilet. If they can only afford a pit latrine, that's one thing. If they want to bump up to a pour flush toilet, they can do that. But the concept is the power rests with them as a customer. And the microfinance markets have been ignoring the poor in terms of sanitation loans and water loans. So we're helping to break through that barrier and get people that $100 loan, $150 loan, so that they can build a toilet, and then they repay that over about 2 years, and it's about 98% that are repaid.
Mm-hmm. Miriam, you've worked trying to create a market and finding out what people actually want and what they can afford and whether, in fact, they can afford. What can you tell us about the experience in Nairobi in trying to sell sanitation to people who don't have it?
I will start by saying I worked with a company called Synergy, and what Synergy does is we franchise low-cost but high-quality toilets to the residents in the urban slums in Nairobi, and we offer marketing for them and daily waste collection of the waste. Bringing a new product to the market has its challenges, and one of the challenges is fear of the unknown and getting people to accept the toilet and actually get to use it. Most entrepreneurs were willing to take up the toilets that we were buying, but having to get users to come and use them was a big problem. And one of the ways that you could tackle this is by advertising and also providing services that the customers are not getting. In the slums where we are operating right now, you find that there is limited access to toilets, and if there is access, you find that they don't have services such as clean water to wash their hands after that, or soap, or a toilet paper to use. And those are some of the things that Synergy was providing, in addition to giving you a place where you can help yourself, but also you have water, you have clean soap, and you have toilet paper to use. And that was very appealing to the residents in the urban slums of Nairobi. In addition to that is the way our toilets are built. They're built in such a way that you can actually place them right next to your house or right next to your restaurant or near your business, and they will not interfere at all with the surrounding. That too was very, very appealing to the residents. Most of them, they could trust this product, that it's clean, it is safe for their kids to use and for their family members to use, and that came a long way in helping us be accepted in the community.
How much were people being asked to pay?
About 5 cents per use, 5 cents per use, and you get all these services.
Right, and is there a month? This is important stuff for a lot of people. Do people have a monthly?
Another thing that was very, very interesting to people, to some of our entrepreneurs who are landlords or who have a larger market, was incorporating things like monthly pay and weekly pay, which is actually way cheaper, because if you pay 5 cents per day and you use the toilet 3 times a day, that will be 3 times expensive as compared to a monthly plan for you just pay for a month and your whole family can use, as opposed to paper every time you visit.
Right, but these are people who had not hitherto paid for sanitation before, am I right? For the most part, these are people who aren't used to paying for a toilet.
Yes, the way it is the way it was before we stepped in was, as I said, there was limited access to any toilet facility, and those which were there, yes, you didn't have to pay for them, but then you didn't have the motivation to go because of the state of the facility.
Got it. How about you, Sebastian? I mean, you were taking this a notch further by offering a private, hygienic toilet within somebody's household. I mean, you can talk a little bit about that, but I'm especially interested in how you deal with the cost of it and creating a sense of value as you market this product.
Well, so I would say coming at it from trying to develop a private toilet, I think there's often a mistake to try and make marketing something that you do after you already have a product, and really marketing is kind of step one of designing a product. So we went in thinking, okay, for a number of reasons, we think it's important. For a number of public health reasons, we believe it's important to really bring sanitation into the home, because, for example, public toilets are often closed at night. If they are open at night, it's still potentially unsafe for women to travel to go there. And there's a number of other reasons why, from the supply-driven standpoint, you would think you want in-home sanitation. But you have to confirm that. So when we went into Shada, the slum where we work in a capitation, the first thing we tried to figure out is what is the ideal toilet for a resident in Shada? Because here in the United States, a toilet is white porcelain flush toilet, because we don't know anything else. But in Haiti, a toilet means a whole range of different things, and you find out what each one means. And then, of course, figure out, so in Haiti, we found that, sure enough, the aspirational product is also the flush toilet, the Western-style flush toilet. But in a place with no roads, no water supply, and no sewer system, you can't be installing flush toilets. But can you create a user experience that evokes that? That's also, it's white, it's easy to clean, it doesn't smell, it's got that really stylish white toilet seat on it that everybody really gravitates to. I mean, maybe it sounds silly here, and we tried it. We take a bucket, and we're with a group of residents of Shada in the community with a bunch of different toilet prototypes, and there's one that says, "Oh, we don't really like that. It doesn't look very good." You just take a toilet seat and put it on top. You say, "Oh, yeah, we really like that. That looks great." And you realize, okay, these are these things that kind of run counter to received wisdom. So received wisdom would be, the poor can't afford something, you need to create the thing that is as bottom dollar, cheap as possible so that they'll be able to afford it. But no, no one wants something that's decent or better than what they have. They want something that calls to mind the thing that they want, that really cool thing. If you want an iPhone and someone's trying to sell you a rotary phone because, hey, this is better than what you've got, you don't have anything, you're not going to pay for that.
So I just might comment on that just real quickly, if I might, because I think you've hit on two really key things here. One is that you've got to understand your market. You've got to understand who the customer is that lacks sanitation. And two, this whole concept of aspiration around sanitation. It does seem really strange to us, but people in the developing world, people living in poverty, really gripping poverty, actually have aspirations around their sanitation needs. And it revolves around dignity, it revolves around the time that they spend walking for water, or walking to defecate, but it really is trying to respond to those aspirations and build in the market forces to make that happen. And I think that's key for everyone here who's thinking about, starting up something, an initiative that would work on this problem, and that is to see if you can get on the ground as soon as possible so that you can start getting inside the heads of people who lack sanitation and really understand it from their perspective and shape responses.
Ed, did you have something?
Yeah, I was just going to say that this session was billed as, or the first sentence read something like, there are more people in the world who have cell phones than have toilets. I actually hate that analogy because it totally misunderstands why we like cell phones, but it also misses the opportunity to learn from cell phones. So our program is really interesting, I think, because it does four things. It actually values what Verizon has done. Simple as that. So Verizon has done a really simple thing. On the one hand, they've developed a range of products. And absolutely right, they have to be aspirational. The days of building crappy, cheap toilets and expecting people to use them was over 20 years ago, and people still do it. So they're trying to drive down the cost, make garbage stuff. People want porcelain, they want water, they want tiles. So understand that. Two is that Verizon gets the service. They get that you have a contract with them, and as a result, you're paying them every month. And if you come in to the area, I want to get you too. So we use that as well. We are trying to figure out what is the service. What the service is really what Sanergy is doing. We've supported 50 companies around the world that are doing basically what Sanergy is doing. And that is this. I got a deal for you. You don't have a toilet. I know you want a toilet. I'll get you a toilet. I'll use microfinance. I'll use a whole range of financial mechanisms. But over time, I'm going to come and clean your toilet. And so you use it, you're going to love it, it's going to look great, it's going to raise your status, you're not going to have to walk, your daughter's not going to get raped, all those things that are really important. And you're going to pay me a fee every month, 2 months, 3 months, whatever it is to come clean your toilet. You have a toilet, I have a business. So we've supported 50 businesses doing that. The third is financial mechanisms. So microfinance does not hit the poorest of the poor. I don't care what anyone says. If you look around the world, the people who are benefiting from toilets are either it's given to them, or if they have to use financial mechanisms, they're generally the middle class in those areas. And you know what? That's okay. The sanitation sector has got to get over this. Okay. Because what ends up happening is, because it's aspirational, is you pull up. And what you have to do is you have to find creative ways to pull the poorest in. So there's a great organization called IDE, which has a program in Cambodia, which is really interesting, and it's about sweeps. So the first sweep is good product, really interesting toilets, right? First sweep is who can buy them without any financial assistance at all. That led to thousands and thousands and thousands of people buying them, using really creative marketing and all of that. Second sweep was they introduced financial mechanisms into that sweep. So they said, okay, I know you want a toilet, but you don't have enough money, so here's some financial incentives, here's some access to loans, and all that. A whole range of other people, thousands and thousands of people then took it. Now they're going back for the third sweep of who does that not hit?
Okay.
And what do you do about that?
Ned, we have an enemy, and that's staring us in the face over here. We're over time.
I get so excited.
Understandably. I wish we could go on, but we're now at the phase where we're going to take some questions from you. If you're bursting forth, we'd like to get a question. We'll go over here. There's a microphone right behind you. State your name and a quick question, please.
My name is Raj, so I actually have a nonprofit organization that works a lot with modification technology, specifically when it uses technology. So my question is, you have this whole idea that clean water filtration technologies that are developing community is going to well, I mean, they work for labs, but they're not going to work if they're not used, right? So I guess my question is twofold. One, how do we get people to use this technology? It's not just a matter of using it, how do we get them to use it? And second of all, we have this idea that this short-term solution will equal a long-term gain. How do we quantify a long-term gain in these communities where a lot of times many organizations don't follow up, many organizations don't take the data. So again, I guess use and follow up.
Okay. Gary.
Sure. So I think the question of use is spot on because there's so many projects that have been built around the world, particularly sanitation projects that aren't used. And so I think that it gets back to the point I was making, is you've got to get inside the mind of the user, the consumer, and really understand what they want, what they value, what they're willing and able to pay for. So we live in a world of charity to a certain extent when we talk about international development. And that's appropriate. There should be times when we apply charity, when we apply subsidies. But you have to do that very carefully because those inherently distort markets. And so, yes, if you're heavily subsidizing the expenditure for something and you can kind of mask the cost for the user, then those recurring costs associated with that, the changing out the filter, after 6 months, all of a sudden it's like, wow, I didn't know I was going to have to pay that. There's no way I can pay that. So then the whole thing goes to waste. So it's no different than really an entrepreneurial approach in this country is really trying to understand who the user is and how you respond to their needs, and not necessarily trusting what they tell you they're willing and able to pay, but finding ways to test that.
Okay, another question?
My name is Hannah, and I have a question specifically for Miriam, but also for everybody else. Sanitation has demonstrated there's a way to make money off of sanitation without charging people for using the drains by creating energy from waste, energy and fertilizer. And so I was just wondering if that was able to be expanded, is there a rationale for charging people to use the drains?
Okay. The whole idea behind Synergy was we franchise it to the entrepreneur, right? And the entrepreneur is offering a service to other community members. So the pay-per-use, the cash that the people pay to use, it actually doesn't go back to the company at all. It goes back to the entrepreneur. And the whole idea is to empower the entrepreneur economically while still creating a positive change to while still offering sanitation to the community. And then this cash that the entrepreneurs get, they can use to expand the businesses and educate their children, take them to school, and have a better life. At the end of it all, we are seeing the sanitation field to have a ripple effect in other lives, in their other lives. So we're not just empowering them just in the sanitation field, but we want their whole life to be a total change, a complete change.
Is there...
Go ahead. I'll step in too on that. In a lot of the numbers that I've crunched on this, something that's really important, people often say there's no demand for sanitation, and that's actually really untrue. There's actually really generally pretty strong demand for toilets and not very good demand for treatment. So people don't inherently care about what happens once the waste gets away from their house, which makes sense. So what resource recovery has the potential to do is really transform that second half of the equation. People don't really want to pay for that, but if we generate value from those after products, we can help subsidize or drastically reduce the cost of the treatment and create a system that actually does preserve public health. So I think that's where you can really leverage that.
I have a quick follow-up to that. Maybe one of you guys can take it. I mean, is there not a dignity also at the consumer level of having the dignity of paying for something as opposed to being at the receiving end of charity? And how powerful is that?
Go ahead.
And is there...
Yeah, I mean, I think Gary's absolutely right, and I think all of us are kind of saying the same thing. People will pay for good service. People are tired of paying for bad things. And so, you mentioned water filters. There are water filters everywhere. There are not supply chains around supporting that they tend to fall apart. People don't want to pay for bad things. Sanergy is an interesting model. I'm the chair of their board, so they're not there yet where you're saying, but people are paying, and they're paying for the service. Why? Because it means that people around the house are not walking through, frankly, shit and urine on the ground. They'll pay for that. And I do think there's this big move around the world, which is really important, where Africans, Asians, and Latin Americans are trying to reclaim their story. And they're trying to not be seen as charity cases. They're tired of NGOs talking about them and selling them in some senses. And I think you're seeing this swing towards, I'll pay for a good service. And again, that's where cell phones have actually been quite helpful.
Let's try and squeeze in two more questions. Is there one in the back of the room?
I'm Jonas Paulus, and my question is, we all know that open defecation is practiced most of Africa and Asia, and this is a huge public health concern. And you know, building toilets, it's not just building a toilet, it's building a toilet that those people in the rural communities can use. I know in the area where I work, a toilet was built, but nobody's using it. It's either too big for them, or it's not a traditional pittle and train. That's what they are mostly common. That's what they are used to. So my question is, do we build toilets just because we think they need it, or do we build toilets because they can actually use it? And if we're building the toilets because we know they can use it, what are some other resources that we are giving them or telling them this is what you need? And just to add one more question to the lady, if you go to a typical royal setting, an average African lives on less than 1.25 cents a day. And to be sincere, how many people can afford to pay to use a toilet? Thank you.
Very good. Anybody want to respond?
Okay, I will start with the second one. So,
Very quickly.
and I would like to say this: if you're thirsty and you go to, if you're really, really thirsty and you go to a shop and you're offered, let's say like a soda, but the soda is put in a can, would you want to buy it? If I offer you a soda in a can and I tell you take it, that is Coca-Cola, would you have it? You wouldn't trust that it's actually Coca-Cola. You'll want Coca-Cola in a bottle. Coming back to your question, people actually, if you give people quality service and you're offering them something that they are not given before, and you're assuring them that their health is actually being improved, then they will pay. And this is something that the people from the community have said. They will pay whatever amount of money as long as their health is, the sanitation is improved, the health of their children is improved, and they're getting quality service, which includes water and soap.
I'll just add quickly that the short answer to your question is no, that toilet should not be built and just assume that it's going to be used. I think that you inherently have a harder task when you're talking about rural areas versus urban areas. The willingness to kind of invest in that sanitation infrastructure is much lower in the urban areas. So that's right out of the gate, a much harder challenge to tackle. But really trying to come up with ways. And I think this is where government can have a role, that the concept of open defecation and why that's wrong, and using approaches like community-led total sanitation to help bring the awareness of all of the things, all of the diseases, all of the challenges that come about because of open defecation, so that the demand starts to build naturally.
Okay, so much for the notion of taking one more question. We are flat out of time. There's probably a number of blanks that haven't been filled in. There's all kinds of material online that have been published by our panelists, and I'd urge you to go on and delve deeper. For right now, we're going to break into our smaller table groups and spend about 10 minutes with the question that's been presented to you for this gathering. And we'll wander down there. We'll wander and listen. Okay, people. All right. If I can have your attention again, we have precious little time left. And we'd like to get as much feedback as we can squeeze in the next 5, 6, 7 minutes or so. So who would like to report from your table on what your takeaway is? Who's the first volunteer? May I see a hand? Or 5? Oh, right over here.
So we talked about shifting from a supply-driven model for supplying sanitation to a demand-driven model. So looking at what communities actually want and shifting to provision of services that looks at, okay, well, they want power, they want chicken feed, or they want, urban models, they do actually want sanitation. So we can provide them a service that looks at those and then provide them with that, instead of walking and being like, well, we think that sanitation is important, so we're going to provide them with that, and because we provide a supply, some sort of exchange is going to So looking for demand, giving them supply, and wanting to change that, instead of only looking for half the equation and half the failure.
Very good. Cool. Who would like to go next? Over there.
We talked briefly about how important it was recognizing the dignity of the people that you're serving, and just appreciating that that was brought up in our discussion. You know, it's not just going to Africa and getting rid of our poor stuff, helping these people out. It's creating relationships with them and respecting them for who they are, helping them, and you know, hopefully making a really lasting contribution. So we just really appreciate hearing that.
Okay. Let's see.
My name is James Bennett. We talked a lot about how you can simply just fill in the toilet, be very charity-based. You can also do so much afterwards, service-based, simply microfinancing or giving initiatives to someone else, donating afterwards.
Can you, I don't know, did you catch most of what he said? It's like, could you hold that microphone
bring it
close to your mouth?
My name is James Bennett from University of Delaware. We talked a lot about how you can simply be charity-based. You know, simply just help with the toilet, get a community need right afterwards. Or you can really be much more service-based, get an initiative with someone who actually lives there, like one of the 50 organizations, for them to help maintain it afterwards, make more compensation, more money, someone local organization.
Okay. Very good. Thanks, James. I think there was a... Who is next? Right over there. To your right. Right over there. The red dress.
Hi, my name is Emma Jones. I go to Elon University, and all of our people we just met, 3 of us have been in Ghana, and we were talking about a project I just went about building a toilet in Ghana. However, there is this whole list of so much experience, and I think one thing that's really important is to update that global experience, because most of them work in Ghana, and not necessarily only work in Swaziland or in Ecuador. And so to get to go out, be on the ground, and evaluate the situation, and then come back and bring that situation back to a larger water organization that's building these toilets. And so consider that this is the time that we need to go out into the world and evaluate that. So thank you.
Great. Why don't we go most conveniently to here, right by the stage. Very good. Next, we'll go to the back of the room, the gentleman with his hands up.
My name is Edward from West Africa. And one of our team will talk more about open dialogue. And the reason is most of the time students like from developing world of Africa with the mentality of the savior, we want to save the people, we want to save the poor people, we want to save them. But I think we can learn a lot from what the people do by doing, by having open dialogue with them. They know they have a problem. Most of the time they know the solution, but they don't have the resources to apply the solution. So you go open dialogue, ask them what's the problem. They'll tell you this is the problem and you think this is the solution. Now we need help. And you help them to get a solution done. Thank you.
Okay. Is there a hand at the table right behind? Go ahead.
My question is kind of
was, and he just asked basically, I was a young lady, and right now there are three issues that have more than over 200,000 NGOs seeking to work. And my concern is that how are we to solve this issue of having all the NGOs not really, fitting the national plan. We have a lot of physical issues right now. We don't have a national plan. But in the future, how do we, us here, sitting here, think about creating policies? How do we come up with better policies for these countries that we're so hopeful for? Because we all think that we're hopeful for them. But at the same time, they all their own government. How do we make that? How do we embrace all of that? We need to really be concerned. I think we come from a good place, but at the same time, sustainability-wise, future-wise, generation-wise, it's really a big concern. I would like to hear what you guys.
Okay, are there any more comments from places we haven't heard? Right over there. Got two more.
I'm Jacob from the University of Delaware, and we discussed that students should also remember that there's also culture of sanitation around the world, and we as Westerners have a very culturally constructed view of how sanitation should be, and that's not the same everywhere in the world. And when you're doing projects, you need to really look at the culture that you're working with and give them the best thing for the location.
Okay, and we've got one more over there. Oh, we might be able to squeeze yet one more after that. Go ahead.
Thank you for the presentation. So I just work with Osman and use the framework implementation project, and I'm from Tajikistan, by the way. And in my country, very good culture, every single household, even in remote areas, they have toilets. But toilet is like basic home with just wall and door, and which is a source of infection diseases because like no one is cleaning actually there. So what is the best strategy of improved sanitation? How we should make our people to think about how they should be built, but not waiting for the assistance, not waiting that Osman or Brussels will come and will make and build toilets for this. It's direct demand, how we should reach now to what you are guys saying.
Okay. We've got time for one more. Was there a hand in the back there? If not, there's a prominent one in the front here, so we'll go really quickly. You have about a minute, and we'll have some final thoughts.
Hi, thanks. My name is Sarah Bolcher. I'm the director of the Women's Initiative, and we actually have a partnership model where we partner churches in the needs of churches in Missouri, and all our projects use water and sanitation, microfinance as well. They're all based on these partnerships. So this actually addresses two issues that several people. One, the sustainability issue that we brought up, which I really appreciated. Having a partnership means that over the course of years and years and years, people who are doing the projects in Mozambique with each church community actually follow up. They go back and they go visit, they write letters, they text one another on their cell phones. So, when we're based in a relationship, this is the sustainable model. And then the second point is just a relationship where we're growing, where we're involved in these projects together in mutual exchange, where it's not me going over and doing something for you, but we're good to grow with one another. So I say all that just to say I think the faith community is a really great avenue to pursue in terms of implementing some of these projects for sustainability and safe water. And I think that it's an important thing to bring to the conversation and see how the community can put in.
Very good. Thank you very much. Wow, supply, not supply, but demand driven. Listen to the customer, sort of like business 101. Good governance, culture of sanitation, lots of great ideas. We have barely scratched the surface, and I encourage you to keep going further. But any closing thoughts from the panelists? We'll go right to left this time, since we went the other way the last time. Gary?
Yeah, I'm just struck by all of the the energy and enthusiasm here, and the receptiveness, frankly, to some of the discussion and how you're already incorporating it. I think, for me, summing up, it's not just all about sanitation, but it's about, whatever social issue, what great social issue of the day that you decide to tackle, and to go after that. And I think that there's a lot of takeaways today if that is sanitation, in terms of how you can do this. I particularly appreciate the shout out about government and engaging government. I think government does have a role to play in this, and they shouldn't just be sidestepped. They should be seen as a collaborative partner. But I guess, just in summing up, figure out what it is that is your greatest passion, and what is the greatest need that you see out there in the world, and look for the intersection between those two, whether that be sanitation or not, and go for it. You've never had more tools, you've never had more power as an individual to get this done. When I started Water Partners in 1990, there was no internet. There was no email. There was no kind of no Kickstarter out there. There was no angel capital. You just kind of had to bootstrap it. There's a lot of those things that are available today. The fact that you are even here at CGIU is an incredible platform to empower you to be able to go out and create that change. So find it what it is and do it. And don't be afraid to go back and forth between the private sector and the nonprofit sector. It happens all the time. It's a very permeable thing, and it's a very good and healthy thing.
Okay, Sebastian?
I want to add, as an engineer, you would think that my bias would be on design, and I would emphasize actually that if you're trying to focus to do a sanitation project or solution, there's so many toilet designs out there, and actually, hopefully I'll get to publish pretty soon our encyclopedia, which is basically more than 100 different toilets that we found online as sort of a reference for what's out there. So find a design that works, test it, make sure it appeals to your users, and it, of course, technically functions. And then the things that you really want to work on are designing watch my language, a really good service, and a really good financing mechanism to keep this thing working perpetually. And then the other comment I wanted to make, especially in the context of Haiti, is I think the government is just mission critical. I don't think I'm unaware of a single successful sanitation system in the world that doesn't have the government involved from day one. Even if the government's not providing the services, the government needs to be inspecting, regulating, managing, because it is ultimately a public good. So, in Haiti, I had a number of what I would say mission critical, make or break meetings with DINEPA, the sanitation authority, both locally and at the national level, where I pitched the concept. I said, look, I think this is a really important idea that we should try at small scale and see if it works, and we'll keep the dialogue open with you guys. And if they had said no, that was it. All I could do was close shop and go home, because if the government's not on board, then forget it.
Okay, very good. Thanks, Sebastian. Miriam?
I'll add to what he said, that there are a number of toilet designs out there, and that is actually very, very true. So what makes you distinct is how you're tackling your consumers' needs. And that means that despite the fact that you're trying to solve a sanitation problem, all of your consumers have different needs. You need to have a million ears to listen to all of them and tailor that one product with one design that you have to cater for all of them. The other thing that I want to say is engage people in the sanitation talks, engage the community, build relationships. Those are very, very necessary, because this is just not your path as a company or an organization. This is a path as a community. Keep people talking about sanitation problems and how they can help themselves out of them.
Yeah, I think I've loved being here. Huge energy. I teach at a lot of universities, and I love the questions and the passion and the desire to change things that's coming from this generation. And I also love the fact that you are not falling for the nonsense of simple solutions any longer. I think the sector has survived on that. So a couple points. The woman from Elon, I love that. Ask hard questions. Ask hard questions about what you're investing in, what you're spending your time in, and what outcomes you're trying to get. That is huge. Second thing is the sector, the development sector in general is shifting from supply-driven. It's gone to demand-driven, and I think it's now going to service or kind of more business principles, which is around things like I said around Verizon. When people sit there and say there are more cell phones than toilets, instead of screaming and yelling and throwing your cell phone and then rushing to pick it up before it really breaks, say, what is it about cell phone providers that I can use to solve bigger social problems? What are they actually teaching us? And what they're teaching us is about ongoing relationships, constant feedback, constant desire to improve, and thinking about services as opposed to things. Verizon doesn't push, I sell this type of phone, or there's 7,000 different phones out there. They show them to you. What they're really pushing is an ongoing service. And when you do that, great new organizations like Sanergy, Clean Team in Ghana, Waste Enterprisers, when you figure out the service, that's when change will happen. So stop looking at the toilet. Toilet's irrelevant. The toilet is a means.
Very good. We have the luxury of a little bit of time, and I'd like to actually pick up finally real quickly on some of the key issues that came up here, maybe one or two. You earlier, Ned, had talked about distinguishing, and it came from the audience as well, different markets. You're not dealing with the monolithic market. Something that works in place A is not necessarily going to work in place B. So I'm just wondering, and there are people who are very poor, you say, who can't afford any sanitation. And how do you find your market of people and reconcile with its smaller number?
I think if you look around the world, there's a very clear sanitation market or distinguish of people. So there are content shitters, right? I'm a content shitter. I go on my bathroom, I go to the bathroom, I flush it, it's gone. I'm content. I don't really need much more. Second is there are people who are using their toilets but want to upgrade. They want a better service. So that's the second market. The third are people who actually don't have a toilet and would really like one. And then the fourth are, frankly, there are a lot of people who are pretty happy defecating outside. And if you go into I started my career in northern Kenya, in the deserts of Kenya. Frankly, if people were pooping in the desert, it wasn't catastrophic. It really wasn't. So it burned out, it died, there was nobody living there, it's okay. So understanding what those different market segments are interested in and understanding creative ways to meet their needs and providing that service is the key to getting away from the monolithic approach to building toilets.
I was just going to remark on how little we'd use the S word in this panel until you came up with
so
this.
Sorry, I didn't mean to bring us down.
Anybody else want to? Actually, we have about a minute left, and I think it might be useful if we got the URLs from each of our organizations, so people can go a little bit deeper. You want to just state yours in the short time that we have left? How do we?
Waterforpeople.org. Very easy.
Okay. Where would you send people to go deeper in?
Sana.gy, Sanaji.
How do you spell that?
Sana, SANER.gy.
Okay.
We're at resourcesanitation.com, all in one word, resourcesanitation.com.
Better get out your pen to write this down, because it's a hard one. Water.org.
Keep your pen out. It's newshour.pbs.org, and check out our social entrepreneurship site, which has a lot of very varied content. Thank you so much for attending. Appreciate it a lot. Thanks especially to our panelists.